if you leave something and your ears are ringing, you have damage to your auditory system, and that will come back later in life.
I was just hoping I was a perfect genetic specimen where I didn't have any issues after that, but clearly...
Everyone has dreams, Ken.
Yeah. What's that? Just kidding.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now, here are your hosts, Dr. Allie and Kevin Ziener.
Welcome back to another episode of Ask an Audiologist. I'm Kevin Ziener.
And I'm Dr. Allie Tressiter.
For today's topic, we're going to be discussing cheating, the only possible way for me to have graduated college. And no, unlike my undergrad degree, instead we will focus on the potential of cheating on a hearing exam. Today's article was written by Dr. Madeline Henry of Link Audiology in the gorgeous state of Washington. So Dr. Allie, let me ask you, how many tests did you cheat on in AUD school?
None.
That's the right answer. That's the absolute right answer. We held her feet to the fire, and
I really did not
honest.
cheat, I swear.
I'd like to say the same. But then
you'd be lying.
I would just like to say that. So I've actually never even thought about the idea of someone going into an audiology practice and being so adamant that they did not, in fact, have or want hearing loss, that they would try to do something to, juice the results in their favor. So how does one even begin to cheat a hearing evaluation exam?
Well, let me start with you can't cheat it.
Okay.
So you can have the intent to cheat it, but we know. So we'll see it with kids a lot. It happens. You see it. Kids will go to optometrists too and act like they have vision loss or have poor vision. But usually in kids, it's more of a cry for attention or there's something else going on. When we look at adults, we see people essentially faking hearing losses a lot if there is some sort of benefit to be reaped, right? And so like a workman's comp type thing, compensation and pension evaluation for the VA or somewhere in the DOD. But they'll come in and a lot of times they'll sit and have a conversation just like this. Mm-hmm. And then all of a sudden you put them in the booth and you turn up the volume as loud as it'll go and they won't press the button when they hear the beep. And so it's right
it's a
off
reverse
the bat.
cheat.
Yeah.
It's an opposite zig instead of zag cheat where they're going to get their eardrums blown out in hopes of receiving some type of care.
Which is actually pretty impressive because the headphones get super loud. And so I have seen people fake it. I was in the military, as everyone knows. And so you'll see people fake hearing losses to get out of things like training or that. And so I'm actually impressed that you can crank it up all the way and they'll sit there. They won't even flinch. So it's actually kind of impressive.
They're like, basic training, not for me. Gonna go into the booth. rather risk that.
Yep.
So in that context, fair. Like I guess I wasn't hoping that you're gonna be like, and here are the top 10 ways to cheat a hearing exam, because who does that benefit, right? That doesn't benefit literally anybody, especially those who need it. And then there's clearly the people who, as you said, for whatever reason, may or may not want a certain result for financial gain or for workman's comp or to get out of basic training, whatever that is. So when you are performing a hearing test, a hearing exam, obviously it's very intricate. There's a lot of nuts and bolts that go into this. Like, what are some of the main tenets that you are looking for so that you can thoroughly diagnose the patient and then give them their results?
Sure. So there's objective tests in the audio test, and there are objective tests, right? And so a subjective test would require some sort of response from the patient. And so that includes going into the booth, pressing the button when you hear the beep, repeating words, case history, and that sort of thing. Mm-hmm. But the objective tests are ones that do not require a response from the patient. And so those include tympanometry. Okay. That's a test when we're testing the function of your middle ear by how your eardrum moves. Acoustic.
You got it. I have faith in you. As determined on this podcast many times, I don't know anything about audiology, but sometimes there are things that I can help with. And if I'm fast enough as a typer, I might be able to find it, but it's not coming up.
To be fair, so full disclosure, I have really bad allergies right now and took 4 nasal sprays and 2 allergy medications.
Love it.
So like, that
Dr.
should
Allie
have been a
has
disclaimer before.
no idea where she is right now.
I don't.
Zero idea.
This podcast has never been so fun.
This podcast isn't real. This podcast isn't real.
But we have something called an auditory brainstem response. We can actually put electrodes on your head, play some sounds, and measure your brain waves in response to those sounds. You can't fake that. Otoacoustic emissions, that's actually one of the easiest tests to do. So your ear is really cool. And when your ear hears a sound, it will actually kind of create an echo. And so we can measure that echo. And so an otoacoustic emission, an OAE, we put a piece in your ear, we play certain frequencies of sound, and your middle ear will emit that echo.
Is it meant to like kind of be a sealant? So like kind of a vacuum so that sound is just within the eardrum and the piece of technology?
It definitely creates a seal, for sure. But so if you have the echo, essentially, those emissions, you cannot have any worse than a mild hearing loss, right? If your hearing loss is worse than that, those go away.
Okay.
And then the last would be acoustic reflexes. Okay. So there are muscles in your ear that will contract in response to sound, and we can actually measure those. And so all of those are objective tests that don't require a response from the patient and give us an idea of the health of the auditory system.
As a doctor or doctors, definitely not you, but maybe other people, have you ever just absolutely whiffed on a hearing test? Like
when you say whiffed,
it's like this hearing loss just went unrecognized and nobody caught it. And definitely it's never been you. Like for sure,
well, obviously,
it's never been you.
It has never and will never be me.
Correct.
Is it
batting 1,000?
Is it possible to miss a hearing loss? Theoretically, yes. So there are disorders like, let's look at like Meniere's disease, right? Meniere's disease can cause fluctuating hearing loss, right? And so you could test a patient on one of their better days and miss potentially the hearing loss that they have on other days. But really, I mean,
if you miss it, is it because it's so faint, it's really not that big of an issue?
I mean, possibly, but our audiologists, we are incredibly thorough in how we test.
Sure.
And so we run enough tests and enough objective tests to be able to make a pretty good conclusion. I mean, it would be pretty far-fetched for somebody to miss a hearing loss.
Got it.
Yeah.
So what is, like, if you go kind of by age or experience or traumatic event, like how often should we, the public who don't know anything about our ears besides listening to the Ask an Audiologist podcast, how frequently should we be getting our hearing checked? And I know that's a moving target.
It's definitely, I mean, it depends on age. We're seeing actually, with over-the-ear headphones and really millennials listening to a lot of really loud music through their headphones, we're seeing hearing losses earlier and earlier. So I think the first time you get a hearing test should be prompted if you're feeling like there's any change to your auditory system, if you're hearing any ringing or anything like that. Yeah. But really at that point, once you feel there's been a change, I would get tested once a year.
Okay.
I mean, just the same way if you wear glasses, you would get your vision tested once a year. It's just great to know the overall health of your auditory system.
I was going to say, I think so often that we all just assume we're fine, right? Because rarely is something so catastrophic that we think like, and now I can't hear, or now my hearing loss is different. It's just gradual, right? And assuming, again, that you're not every day pumping loud music into your ears, or you don't work on a construction site, or you aren't a babysitter for 10,000 screaming children, there is just a slow decline in your hearing. And it's probably better to know sooner rather than later what the baseline is.
Yes, for sure. I mean, if it were my choice, I would have everybody go get a hearing test tomorrow to know where they're at. Yeah. Because like we mentioned when we talked about OTCs and the perception of hearing loss, people can have a hearing loss and think that they're totally fine, not perceive any hearing loss, or just think that everyone around them mumbles. It's not them, it's everyone else. So really just knowing where they're at right now would be really important.
That's the key thing. It's just understanding. Hey, even if it's not terrible, that requires any type of hearing aid or hearing instrument, like this is where you're at today.
Well, for sure.
We'll see you in a year's time and we can map it.
Well, and especially because people are exposed to noise and don't really realize the cumulative effects, right? Like how many times have you been, out and you're crossing the street and a big truck passes by and it's a really loud sound, right? Like after that one incident, you don't think like, hey, maybe that damaged my hearing. But
I've been to enough concerts where I assumed I had hearing loss and that my hearing was never going to come back, and I was nowhere even near a speaker. So understanding that, and me probably not being the minority in this, where we've all left sporting events or music events, and we're like, well, that was fun hearing that part of my life. Now it's forever gone. Yeah.
Yeah, no, for sure. For sure. Especially after something like that.
Yeah.
If you leave something and your ears are ringing, you have damage to your auditory system, and that will come back to kind of welcome itself back into your life later in life.
I was just hoping I was a perfect genetic specimen where I didn't have any issues after that, but clearly.
Everyone has dreams, Kev.
Yeah. What's that? Just kidding. All right. Thank you, Dr. Madeline and Link Audiology. To learn more about all things audiology, please visit askanaudiologist.com. And to learn more about ways to cheat without getting caught, just DM me on my Instagram.
You can't cheat. You can't do it.
Kevin Zehner. If you just want to cheat in general. Dr. Allie, as always, thank you.
Thanks, Kev.
See you guys next week.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only and does not substitute for professional medical advice.
Talk to me about all the foods that may or may not cause earwax buildup.